Hello everyone, welcome back. So let's move on with next question. A patient has aneurysm in the right subclavian artery and has a husky voice. So irritation of which nerve can it be connected with? So let's move on to recurrent laryngeal nerve. Let's talk about this. It is actually a branch of vagus nerve. That is a 10th cranial nerve. And it is derived from the 6th pharyngeal arch. I'll make a separate video on this topic, but let's just remember that it is derived from the 6th pharyngeal arch. Next, it supplies to the intrinsic muscle of larynx, except cricothyroid. Which is supplied by the superior laryngeal nerve. The superior laryngeal, it is another branch of the vagus nerve. So very important exception. Let's just highlight it. Okay, so next point that it supplies this was the motor part, and it supplies to the laryngeal mucosa. It supplies the laryngeal mucosa below the vocal cords. Okay, so let's move on with the right and left recurrent laryngeal nerve. Let's compare them. So this is a picture to show you. This is the left vagus nerve, this is the right vagus nerve, and both of them, as they're traveling down, they give off a recurrent laryngeal nerve which travels back upward. That is why it is called recurrent. So you can see that left recurrent laryngeal nerve, it is a bit longer because it has to arch under, because it travels under the arc of aorta. And arc of aorta is present in the thorax. So which recurrent laryngeal nerve enters the thorax? That is the left one. And the right one, it is traveling under the right subclavian artery. So it stays in the neck only. So let's write it down. The left one is longer and it is short. It stays in the neck while it enters the thorax. And the right one, it is traveling under the right subclavian artery. And it travels under the arc of aorta. But it is also related to the ligamentum arteriosum. So it is traveling posterior to ligamentum arteriosum also, and both of them, they are posterior to the thyroid gland. So whenever there is surgery of thyroid gland, the doctor should be careful not to damage these nerves. So when there is a unilateral damage, that is only one side of the nerve is damaged, there will only be voice changes. And when there is bilateral damage, that is both left and right recurrent laryngeal nerves are damaged, there will be breathing difficulties. And I'll tell you why. Just a minute. and also aphonia. Why? That is inability to speak. So again in this picture, I'll use a different color. This is the left recurrent laryngeal nerve. This is the thyroid gland. It is traveling posterior to the thyroid gland. And this is the right recurrent laryngeal nerve. It is traveling under the right subclavian artery, and it is also traveling posterior to the thyroid gland to then supply the laryngeal muscles. So these are the intrinsic muscles of larynx that the recurrent laryngeal nerve supplies. And if you remember, the cricothyroid was the only one that was supplied by the it was supplied by the superior laryngeal nerve, and that to the external branch. And that to the external branch. So cricothyroid is supplied by the external branch of superior laryngeal nerve, and all the other muscles they are supplied by the recurrent laryngeal nerve. So what are the main function of intrinsic muscles is that they control the length and the tension of the vocal cords. So cricothyroid is the tensor of vocal cord. Thyroarytenoid is the relaxer. Posterior trichoarytenoid, it is the only abductor of vocal ligament, that is it is the only one that will open the vocal ligaments and widen the rima glottidis, that is the space between the two ligaments. And the lateral cricoarytenoid, it is the adductor. So it will bring the two vocal ligaments or vocal cords together. So that was about these muscles. So another important out of these is first of all the cricothyroid, because it is not supplied by the recurrent laryngeal nerve, it is supplied by superior laryngeal nerve, and all the other are supplied by the recurrent laryngeal nerve. Next important muscle is the posterior trichoarytenoid. It is the only abductor of vocal cord. It will open the vocal cord, and that will help in the breathing. Because if the vocal cords are closed or sticking together, there will be difficulty breathing. So that is why it is also called the safety muscle. So that's why it is also called the safety muscle of larynx, because it helps you to breathe. How? By opening the vocal cords or by abducting the vocal cords. So that's why when I told you that when there will be bilateral damage, there will be breathing difficulties. So now you can understand why, because there will be damage to the posterior cricoarytenoid muscle, which was the only abductor of vocal cords. So therefore there will be breathing difficulties. So let's look at this question. So there was aneurysm or dilation of the right subclavian artery. That is why it was impinging on the recurrent laryngeal nerve. And recurrent laryngeal nerve, it was supplying to the intrinsic muscles of larynx. So that's why the voice changes are occurring. That is husky voice. So I told you about the superior laryngeal nerve, that it was supplying the cricothyroid muscle, which was a tensor of larynx. So another question that is, a patient again revealed the aneurysm in the area of aortic arc that caused alteration of the vocal function of larynx. So again, vocal function is compromised. So the nerve will be mainly the recurrent laryngeal, and that too, why? Because it is written that it was aneurysm in the area of arc of aorta. So they are talking about the left recurrent laryngeal nerve, and in the previous question they were talking about the right recurrent laryngeal nerve, because again the right one was traveling under the subclavian artery, while the left one was traveling under the right arc of aorta. So that was this question. This question is from the base anatomy base. So another question, or just a correlated thing that at least I used to get confused, was between subclavian vein and subclavian artery. So subclavian artery is basically associated with the recurrent laryngeal nerve, and the subclavian vein, it is associated with the phrenic nerve. Now let's see this question. This is question number 4. So it is necessary to catheterize, that is insert a needle into the vein. It is necessary to catheterize a patient and into the subclavian vein. And what they're talking about is location. So this is the anterior scalene muscle. It is attaching to the first rib. So there are two main vessels. The space in front of it, it is called the anterscalenum, and the space behind it, that is between the anterior and the middle scalene muscle, it is the spatium interscalenum, that is the interscalene space. So you can see its relations. So in front of the anterior scalene is the subclavian vein, and behind it is the subclavian artery. Okay, and another thing, so you can see this was the vagus nerve. It was then giving a branch to recurrent laryngeal nerve, which was traveling under the subclavian artery. So subclavian artery is associated with recurrent laryngeal nerve, or you can even say the vagus nerve. While when you look at the phrenic nerve, it is passing anterior to the anterior scalene muscle. So it is often related to the subclavian vein. And now you know that subclavian vein is present in the spatium interscalenum. And what is present in interscalene space? That is the subclavian artery, and actually there are also present the brachial plexus. The branches of the brachial plexus are also present between the interscalene space, but mainly the subclavian artery. So next question. This question, a patient was admitted with deflection of the tongue to the side when extruded, means when it is protruded, extruded, or when it is the tongue is moved out. So there is atrophic changes in the half of tongue. They have not mentioned which half. Logopathy, that is this problem with speech. Deglutative, that is a swallowing problem. So you can see all these are the functions of tongue, right? It helps in the speech, it helps in swallowing. These two are the functions of tongue. So, and in the previous video, I told you that the tongue, all the muscles are supplied by the hypoglossal nerve. So when there is damage to hypoglossal nerve, when the tongue is protruded out, it will move towards the side of lesion. So if there is, it will move towards, not move, actually, it will deflect towards the side of lesion. What does it mean? That if the left hypoglossal nerve is damaged, so when the tongue is protruded, it will deflect towards the left side. So a very easy question.